Did you not have this on?
Okay, so what we're going to talk about now, or what we're going to demonstrate, is doing some transabdominal ultrasound imaging. And for that, we're going to use the curvilinear probe, which is this one. It's kind of curved. And we've also used to move to a different machine just to highlight that although the machines may be different, their similar functions are not that different from machine to machine. So first thing we need to do is make sure we've got the curvilinear probe. So if it was the other machine, we could flip between the probes, but this only takes one probe, so we have to make sure that this probe is attached into the back of the ultrasound unit. So this looks like a giant upwardly facing cone, or as I like to call it, the flashlight. So this is now set up for transperineal scanning, which the model may be a bit concerned about because that wasn't in the contract. So we need to change this really, because this is set up for transperineal scanning, which we'll come to sooner or later. And what I'm going to do is just flip this now on this machine. So sometimes you've got to just investigate. So the flip button, so if we come out, that's the whole screen. The flip button is this one, and we can change this by pressing here. Actually, rewind, it's the one below it. So it's up, down, flip. And this is in the correct position now to do transabdominal scanning. So I like to look at doing functional pelvic floor assessment. But what we tend to do first of all is really see, can that patient, in this case a female patient, can they do that contraction in lying? And also in lying we get a nice opportunity to see what's happening with the abdominal muscles, the rib cage, the breath. The breath is important. And also what's happening really with that platysma in the jaw muscles and the neck. And also what's happening with the adductors and the knees and the gluteal muscles. And sometimes patients will fix with their elbows. So we want to look at all that, but we want to then see what's happening inside. This is kind of looking inside but staying outside, as we like to say. So where is the probe going to go? So the model is in a supine position. The knees are bent up. We've got a nice towel covering the lower garments, and I'm going to place the probe just kind of over, just kind of superior to the pubic symphysis. Really, as we've said before, loads of gel is really preferable. And I'll just take the probe back. The M here, we talked a lot about that, so that's on the left side of the screen. So I'm going to keep that. I'm going to put the probe on like this, so the marker is on that side. So I'm just going to put this on the patient. So this probe is going just probably about a couple of inches above the pubic symphysis. And what's my angle? My angle is probably about 45 degrees, 60 degrees. That's me if my angle was vertical, 90 degrees. Coming down now to about 45 degrees. And what we're looking for, just going to change this a little bit. What we're looking for there is that cylinder, which is really, yeah, that's a bit better. Trying to get that nice kind of flat white edge lower end of the bladder. And then in this position we could also do residual bladder volume. So if we were concerned about urinary retention, the machine has a preset to do residual bladder volume, where you can use the measurement function to measure this. We would then send the patient off to void, and then when they come back in, we would re-measure it. But we're not going to do that at the moment. So what we're going to get the model to do, we want to see, let's say this is a maybe postnatal patient. It might be a patient who's maybe postmenopausal, got some urinary symptoms. It may be a pelvic pain patient where we think there's not great activity, but probably the mechanism underlying that's quite different, maybe a dysfunction due to overuse. So I'm going to look at that flat lower part of the bladder, and I'm going to get the model just to do some fast pelvic floor contractions. Away you go. And that's really what we're trying to see is, just relax there for a moment, is are we getting a nice lift of the base of the bladder? Let's do it again. But we do need to remind ourselves that we are doing this in a supine position, where there isn't much weight on the bladder. There isn't that kind of body weight. There isn't the weight, there isn't much weight on the pelvic floor. There isn't the body weight, the abdominal contents, the weight of the bladder. So sometimes people may get a contraction in lying, but then when you load them up in standing, it feels very different. And just give me a moment there. And a nice test I use is kind of extrapolated from my good friend and colleague Jo Milios' work. She does the time for 10 seconds, time for 10 repetitions. And we'll all do this in a moment, just sitting at home. So what I would get the model to do is, and I'd have the model really looking at the screen, explaining, educating the patient that we're going to see, can they do 10 fast contractions, seeing a nice lift each time, and how long it takes to do that. And later on, we will see what's the average in the group to do that. We can get an average then. We also want to do the timed hold test. This is more looking at slow fibre contraction. It's about 70% of the pelvic floor. So this time I get the model to do a slow pelvic floor contraction, and I've already explained to the model what she's going to do. So, can you do a nice slow contraction and hold? Getting a nice lift there, and hold, 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 and let go. It's very good. And again, hold, 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 and let go. And I'm not really too worried about the symmetry, but there is good symmetry there. But some people get a little bit fixated, is it more right, left, but the reliability of that's quite poor. So what we might want to do next with this patient is see, well, what's the timed hold test like? So we'll get them to do a contraction, see how long they can hold that for, and that would be a nice baseline for us to do. Now I'm just going to get the model to hold the probe, and I have a handover of the probe. Just going to refine this a little bit. Okay, so we talked a little bit about some objective markers. So I want to see, well, really, how far is the base of this bladder elevated? So I'm going to go down to the arrow key and press that. And align that arrow here. And then, so one arrow, we can't really see that first arrow, but it is there. Okay, can you just do a slow contraction, nice big slow contraction, and hold it? bit more, bit more, bit more. Big effort to turn around. Hold, 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 and let go. So we could then, if we wanted, we could measure that distance to see, well, the patient, their first appointment, they've come maybe with what we feel like some pelvic floor weakness, and we could see, well, they're getting an elevation of that's not wonderful, but you know, they have already done a lot of work here with this already today. But let's measure that. So it's good to see how we measure on this machine. So we have frozen it. I'm going to go to measure. Caliper. Actually, we may need to come back. Sorry, just one moment. Actually, it's set up for bladder volume, which I hadn't changed. Okay, so we'll come back to that in a moment. Okay, it's going to come out of that. Right, so the next thing we might want to do is, let's say that this isn't a pelvic floor kind of contraction problem or weakness problem, it's more a pelvic pain type presentation. So let's do the pelvic pain presentation next. So I'll just stop this remote.